October 29th is World Stroke Day. The American Heart Association is out with simple steps to avoid having a stroke and a fast way to notice the warning signs. Joining us now, Dr. Carolyn D. Brockington. Thank you for being here.
Well, thank you for inviting me. I appreciate it.
What's the main message you would like to get out?
Well, this is American Heart and American Stroke Association really promoting World Stroke Day, which is a time to bring up stroke awareness, what to do about a stroke, and how to prevent a stroke.
We are on the trading floor where stress levels can be high. Can you give us a breakdown of the warning signs?
It's interesting because, stroke is scary, so a lot of people don't even want to think, are they having a stroke? But really the most important thing is to identify the signs and symptoms of stroke and go into the hospital right away. So the warning signs are really when the brain doesn't get enough blood flow, and that can happen over seconds to minutes. Suddenly someone develops symptoms. So we have an acronym, or the American Heart and American Stroke Association use an acronym FAST. So if you think of the word F-A-S-T, we want people to act fast. So you think of the word or the letter F for face. You look at someone's face, is it drooping on one side? They might be having a stroke. You ask them to raise their arms. Are they able to raise both arms, or is one arm constantly drifting down? They might be having a stroke. S is for speech, so you ask them to speak. Are they having garbled speech, almost as if they're drunk? Or are they having difficulty communicating with you, where they can't express or they don't understand what you're saying? And then T is for time. In stroke treatment, we say time is brain, because the faster someone gets to the hospital, the more likely we're able to give them the appropriate treatment and really reduce any disability that they might have from stroke. So we want people to act fast. Remember F-A-S-T, and you know what to do, some of the signs and symptoms of stroke, and what to do if you or yourself or someone else is having a stroke.
As a doctor, just how much of a difference does it make to recognize a stroke right away?
Yeah, it's unbelievable, because we see people coming in almost neurologically devastated, meaning they can't move their arm, they can't speak. But if they come in right away and we're able to give them the appropriate treatment, they can go home in a few days and back to their life. So it really does make a difference. The brain has such tremendous ability for recovery, but it has to be treated right away. So that's why there's this big push for people to understand what a stroke is, that we have appropriate treatment for stroke, and that they have to come into the hospital, because it really can change your life in a matter of minutes. So calling 911 is important. Even if you're wrong, let's say that it's not a stroke, it's better to err on the side of being wrong rather than to wait and then have a devastating stroke that you may not recover well from.
Is there anything else we need to know before you take off today?
Well, strokeassociation.org can give you all the information regarding your risk factors for stroke, what to do if you or yourself or somebody else is having a stroke, and what to do. But really the two most important pieces of information is, number one, if someone's having a stroke, to call 911 immediately. And the other thing is that up to 80% of strokes can be prevented. So that know your risk factors. We know that high blood pressure is a significant risk factor for stroke. Having diabetes is a significant risk factor for stroke. Smoking. So again, discuss your own personal risk factors with your doctor. Control them appropriately, which may mean diet, lifestyle changes, sometimes medication. And then having a discussion in order to what you can do to control these risk factors to reduce your risk of stroke your entire life.
Thank you, doctor, for being here and bringing us this critical information.
Thank you very much.